Hey, everybody. Good morning, good evening, good afternoon. It's Dr. Eric Nepute. Hope you're having a blessed day today. Hey, I'm really excited. I get the opportunity to share with you what I know is the solution to our broken healthcare system. And with your help, it's going to be a massive influx to our wealth care system as well. Like, I want you to understand that we know, we know that right now we're spending over $5 trillion a year in the United States of America alone on our broken healthcare system. This system is the leading cause or one of the leading causes of death in America today. You know, if you look at the top leading cause of death, you'll find that number one in the USA is heart disease. Number two is cancer. And number three is called iatrogenic death, death by medicine. Yes, that's right, folks. The healthcare system truly is the third leading cause of death in America. And it's one of the top five leading causes of death globally. I mean, think about that just for a minute. Our system is not even just broken, it's completely doing the opposite of what it's designed originally to do. What if I told you there was a system that could put health and care back into healthcare? We've created it. Today, I'm going to share with you some really amazing information about the Biolimitless Centers of Excellence that I know can be a huge component to do exactly what this current administration wants to do, the Make America Healthy Again campaign that I'm a huge part of and I've been a part of since 2020. I was just with Bobby Kennedy Jr. and his team recently talking about some of these problems and the solution to how we can remove $2 trillion of unnecessary spending from our healthcare system. Could you imagine how much better we would be from a system and an economic standpoint if we could get better results, if it was more accessible and it cost less to do it? Let me show you something. First of all, I want you to understand that physiology doesn't lie. We test, we don't guess. And the real healthcare is self-care. The more you understand how to take care of yourself, the better that you're going to be, the better you're going to be able to take care of your family. And doctors that are watching this, the better you can educate your patients, the better you can do your job, because doctor is Latin for teacher, not drug dealer. So check this out. I'm going to show you something. This is an overview of our biolimitless ecosystem. Now, there's a lot of pieces to the puzzle of the biolimitless ecosystem. And let's just say that over here on the left, whether you're an employee or an individual, employee controlled dollars or medical shared dollars or insurance companies, if you will, even though I'm not a big fan of either of those, but dollars go into the system here to the patient. Ultimately, a patient ends up needing to see a healthcare practitioner. And the system that we have today typically pulls them into hospitals or surgeries, which is an unnecessary spend and most of the time an unnecessary solution for a problem that wasn't even surgical or emergency in the first place. What if there was a system where when the patient plugged into it, they could actually have direct or virtual care to a primary physician? We have that in our biolimitless centers. We have telehealth and we have brick and mortar health. What if we were able to plug patients into a system where they could see specialty care, whether it's a GI doctor, a cardiovascular doctor, an orthopedic surgeon, at a discounted service that was a fraction of the price of what it cost in the established system and got better results? What if we were able to mitigate the cost of medications and medical devices that people get? What if we're able to reduce the expense? What if we could get, let's just say, for example, a blood pressure medication that could be hundreds of dollars for just a few dollars? What if we could get medical devices like knee braces, back braces, TENS units, and much more that normally cost hundreds, if not thousands of dollars for a few $100? The same thing with lab images and so much more. The system has been created. I want to show you some examples of why we know that we're going to be such a powerful object to this system, and that's the Biolimitless Centers of Excellence. One of our programs alone, our Doctor of Primary Care program, which our Centers of Excellence are going to be offering, versus hospital charges. I want you to take a look at this for a minute. This is the same patient getting the same work done for lab fees, chemistry reads, a blood hematology, urology visit, chest x-rays, CT scan, and then a level 4 office visit at a hospital versus at a DPC organization. Look at this. It's almost $20,000 compared to $300. The goal is to reduce healthcare expenses as a nation. Our current system that exists to this day is fantastic at extracting dollars from the American economy. We have a solution that is going to offset that. Let me give you an example. The idea that RFK Jr. and many other like-minded individuals on both sides of all political aisles is to remove $2 trillion from the broken healthcare system. We've already proven this model. Look at this. With DeSoto Memorial Hospital, we took 157 employees. Their normal out-of-pocket expense is $2.3 million per year. We were able to save them $1.2 million in actual dollars. We were able to show the city of Orlando, if we just worked with their employees alone, there's 7,000 employees, and we use the DPC program that we've got, their normal out expense pocket is $98 million. We could save them $39 million annually. If the entire state of Florida, their employees, the 160,000 of them did the same thing, they spend $2.3 billion annually. We can save them $896 million with just our system. And the entire workforce of Florida, all 10 million of those employees are spending $140 billion annually. We can show them a $56 billion a year savings. Folks, that's one of the major differences that Biolimitless Centers of Excellence has. Because we focus on the 5 pillars of human performance. We don't focus on symptoms and managing diseases. We look at genetic profiles. We look at nervous system health and brain function, autonomic nervous system. We look at the microbiome, and we look at cellular health and the cellular matrix. We measure the 5 pillars of human performance through our 3-tiered examination system, where we assess the 5 pillars, where we test, we don't guess, in real time, with real data, with real common sense pricing and real common sense solutions. Look at our 3 examinations we have. By the way, this can be done over 1 visit or over a course of 3 or 4 visits, where we have a basic neuromuscular exam that looks at the structure of the body and looks at the muscles, where we measure the moderate exam, which is functional medicine and functional neurology, assessing the root cause of chronic illness, which is destroying our global economy. And then we look at elite human performance, where we optimize longevity and vitality in all humans. Let's just break down our exam. Our basic neuromuscular skeletal exam measures heart rate variability. It measures thermography. It measures surface EMG, X-rays, ultrasounds, and MRIs to look at structure, to make sure that we have proper alignment and there's no degenerative changes. And we do a specific urinalysis to look at metabolic disorders and hydration and nutraceuticals and pH and digestive function. The heart rate variability is the gold standard for measuring brain activity, where we have non-invasive tests where we can measure the autonomic nervous system and how it relates to function and performance of the physical body. It provides real-time insights to the body's response to internal and external stresses and how we respond to those stresses. And we can monitor patients' progress and effectiveness over time. This HRV testing can be done in about 7 to 10 minutes, and the clinical applications for cardiovascular health, for inflammatory health, and for helping the body deal with chronic stress, anxiety, autonomic imbalances, including musculoskeletal issues, are off the charts high. We can tell by measuring these 5 brain waves more about that individual's personality than they even know about themselves. And it's a proven and accurate tool for measuring stress response and physical recovery in the body. We also measure thermography. It's a non-invasive imaging that detects early inflammation and patterns in the body that could lead to certain issues such as organ dysfunction, muscle imbalances, and even cancers. And it gives us real-time insights to guide personalized treatment plans for the individual, and enhances patient care by, again, monitoring the progress. These are non-invasive, non-expensive tests that we can run on a regular, recurrent basis to watch the progress and improvement of our patients. We do surface EMG, which measures muscle function. Look, we know that the majority of joint problems that leads to musculoskeletal pain and ultimately joint replacements that are expensive and not always very effective is caused by imbalances in the musculature, whether it's in the joints of the knee, the hip, the ankle, the elbow, the shoulder, even the fingers, and even in the spine. And we can enhance patient care, again, by tracking muscle recovery response to the treatments that we're giving it in real time. And then, folks, we always say to see is to know, and not to know is to guess. We want to take x-rays. If it hurts, let's take a picture of it. Let's find out where the problem is. Is there misalignment? Is there degeneration? Do we have fractures? Look, I can't tell you the countless amount of times in my 20 plus years of clinical practice where we had someone come in to one of our offices, seemingly with just some type of musculoskeletal pain, and we took an x-ray and found out they had a bone disease or cancer. It removes the guesswork out of it. It's essential for monitoring progress and really preventing further injuries. And the support of research behind imaging is, I mean, we don't have to bring it up. It's top notch. And then we run a very specific urinalysis test, and this urinalysis test really gives us an idea of overall chemistry. It gives us an idea of the pH, which Otto Weinberg won a Nobel Prize for finding that if pH is acidic, our body is going to be in a state of dis-ease and inflammation. It can detect underlying infections and dehydration and enzyme deficiencies, and we can look and see if there's candida or yeast infections or parasites or etc. just in the urine sample. This test by itself, if you understand how to read it, can be a game changer for your patients. And then after the physical assessment, we're going to be able to put into play physical medicine therapies, customized protocols of osteopathic medicine, chiropractic medicine, physical therapy, other therapeutics intended to improve functionality, reduce pain, and improve quality of life, including peptides, stem cells, and much more. Our functional medicine examination and functional neuro examination, where we look at the EKG and the autonomic nervous system and a comprehensive blood panel. The EKG is the gold standard for measuring heart function. Again, I can't tell you how many patients that my 20 years of practice, we were able to find things like ischemias and arrhythmias and claudications and cardiovascular issues. They didn't even have symptoms for it, and we knew where it was coming from. It's literally like being able to tell patients that they're standing on the railroad tracks and the train's coming and they need to get off the train they get off the track before the train hits them. And then we have advanced autonomic nervous system testing. This advanced autonomic nervous system and microcirculation testing can, within 7 to 10 minutes, can give a full assessment of the autonomic nervous system health. Do you have insulin resistance going on? What's going on with your epithelial and endothelial linings, which are the outside linings of all your organs and all your cells, which is so important to know that. It can tell us what's going on with your cardiovascular and autonomic nervous system. It can tell us if you've got pain that's coming from veins and arteries versus nerves that are damaged. It can tell us if you have early detection of metabolic diseases like syndrome X and type 2 diabetes. I mean, this is a level of looking at cellular health and neurological function that most people don't even know exists to this day. We can evaluate cardiovascular and hypoglycemic risk markers and to a 95.7% accuracy. Plus, we get a really cool report of all this that the doctors understand thoroughly and the patients can take home and go, this is what's going on. Now they can form an action plan to prevent or even reverse some of the damage that's been done. We run a comprehensive metabolic blood panel as well to look at inflammatory markers and vitamin and mineral levels and metabolic health. And we can detect hormone imbalances and risk of chronic disease factors. And obviously we can enhance patient care by offering personalized food plans, personalized IV therapies, personalized peptides, personalized hormone therapy, personalized everything based off of that individual's own need. This is what you have to understand. We have to have precision medicine. It has to be personalized medicine, but it's got to be done through precision diagnostics. Then when we're done with the moderate examination, now we can bring the physical medicine in with now the functional medicine and the functional neurology. We can fix the brain, we can fix the cells, we can get the organs proper. So the moderate exam includes the basic plus the moderate. Now let's look at our elite examination. That includes the basic, the moderate, and now the elite testing, which is ultrasound. Listen, ultrasound of the thyroid, the abdominal aorta, the heart, the kidneys, the carotid arteries. It's a non-invasive imaging that can tell us the function of the vessels and the organs, which is huge because I will tell you that we could have patients that have blood clots or narrowing of the arteries or heart dysfunction or thyroid or kidney dysfunction that doesn't show up on a blood test, that gets missed unless somebody has a major symptom, or the number one symptom that people have, like I said, with cardiovascular issues, is they have a heart attack. They have a heart attack that kills them. So folks, we have unbelievable abilities to support early diagnosis of cardiovascular, kidney-related issues and enhance our patients' outcomes. This is true precision medicine. This is true healthcare. This is you understanding yourself on a level that you didn't even know was possible. And then we have genetic analysis. We can measure 800,000 SNPs, and we can give you a precision printout. And by the way, an application that tells you what vitamins you should have, what exercise you should have. We literally can put a customized food plan on your app so that you can not only see what to eat, but when to eat, and recipes on there. We can reveal genetic predispositions for chronic conditions like heart disease, diabetes, mental illness, and much, much more. This is a level of enhanced patient care that literally looks like Star Trek type stuff into the future and beyond. We have access to that now. And then after our elite examination, now we can add more physical exercise programs, peptides, stem cells, nutraceuticals, pharmaceuticals into the mix that are customized for each individual. And I want to tell you that self-care starts here. The Biolimitless Centers of Excellence are centers where you can go that is a one-stop shop, where you can finally have hope and certainty again. And what's important to us is that it's not just a center of excellence where you can get the best treatment and you have the best bedside manner and hospitality care that you could ever think of in a facility that we've created, but it encompasses the community. That it's a system that's by the people, of the people, and for the people. And it starts here. I'm honored to be the chief visionary officer. 20 plus years. I've been in functional medicine, functional neurology. I've helped train hundreds of doctors. I've helped implement technologies and services in my biotech companies all across the globe. It's not my first rodeo. I've been part owner of a hospital, surgical centers, nutraceutical companies, pharmaceutical companies. I've owned and operated over 30 of my own practices. We have a vision to help people get to the root of their problems. Dr. CJ Mertz is our chief executive officer. He's helped open up and operate over 16,000 doctors' offices. Our chief operating officer is someone who's ran clinics, who's ran franchises globally, who understands how to deal with processes and systems from a global standpoint. Our chief longevity officer is someone who is world renowned in the art of longevity, has written multiple New York Times best-selling books, and we know how to improve the length and longevity of our patients. Our chief marketing strategist, we understand how to attract masses of people into the facilities, and you button that up with the crowd funding component that we're doing to this. It's absolutely unbelievable. So we truly have put the dream team together, and I'll share more of that with you at some other time. But today I want to talk to you a little bit about our model, our corporate reinvestment model, if you will. We are opening up centers of excellence all across the globe. We're opening up 200 centers in the next 3 years globally, and in the US, and 2,000 over the next 7. The first raise that we're doing for the first 4 clinics that, by the way, are located in Austin, Texas, Dallas, the Woodlands right outside of Houston, and then St. Louis, Missouri. Those centers, listen to this, it's $6.25 million for each location. It's $25 million total for all 4. And it's 100%, by the way, 100% of the profits goes back to the investors who invest in this, whether it's the crowdfund investors, whether it's private equity, whether it's commercial investing, whatever that may be. 100% of the profits goes back to the investors until the full 25 million is returned. Once the ROI is completed on this, investors will receive 40% of all future profits. Listen to this: 20% of profits, 20% of the profits sharing. 20% of the profit goes into a profit sharing pool, which is shared with qualified investors. And we'll talk about that in a minute. And the remaining 40% will be used to reinvest into opening additional 4 clinics. So the first 4 that you invest in, you have the opportunity that 4 is going to turn into 8, or the 1 will turn into 2, however you decide to do what you do. And any unused capital from the 25 million that we raise will also be used towards the additional clinics. And by the way, profit and revenue projections shown do not include the additional 4 clinics with the reinvestment. It's just the initial 4. 100% of the profits goes back to the investors until the original 25 million is recouped. It's a pretty phenomenal deal. Now, the Biolimitless Centers of Excellence, our care plans, I want you to see this. Our care plans, we have folks that are going to be coming in for chronic illness, for corrective care plans, and for wellness and longevity. We literally have something for everyone. If you've got a problem, we're here to find the solution. If you don't have a problem, we're here to help you so that problems don't start to exist or persist. We test, not guess. That's the core value of Biolimitless Centers of Excellence. When a patient first comes to us, the number one goal is to listen what's wrong with them and help them find the root. Our job is to educate people. We have care plans that could be as low as a couple $1,000s a year for people, and we have some that might be 150 to 200,000 plus a year, depending upon what they need and what they want. The results, by the way, for revenues, like our new patient acquisitions, our goal, we're going to attract a minimum of 100 new patients per month in our offices. But I wanted to show you just 50% of those KPIs. By the way, just on an average care plan of 8,200 across the board, with a conversion of a 2-year conversion of 80% and a long-term conversion of 70%. And each facility has the capacity to see around 6,000 plus patients. In the first year alone, that's 4.9 million with just 600 patients. In year 2, it's 8.8 million with 1,080 patients. Year 3, it's 11.6 million with 1,416 patients. Year 4, 14 million with just 1,700 patients. And year 5, it's 17 million with 2,088 patients. You see how this can grow rapidly. That's just with 50% of our KPIs being hit. And I will tell you, in the last 20 years of my own practices, all of my offices attract a minimum of 100 new patients a month. By the way, profits per clinic, if you look at this for annual profits, the first year, you're going to see 3,125,000. That 3.1 million is 50% ROI. That goes back to the investors. Year 1, we're not going to see an ROI pool. Why? Because we don't have that money paid back yet to the investors. As soon as that's done, boom, now we start seeing profit pools. Year 2 is where that happens. 6.25 million per clinic, okay, per clinic in year 2. Year 2 investors are going to get 4.3 million back to them. It's 70% of their ROI. Year 2 profit pools begin, 629,000 for year 2 profit pools. Year 3, 9 million as an annual profit. We're going to have year 3 investment return. So 3.6 million goes back to the investors. That's 58% ROI. Now we start to see the profit pools really going up. It's 1.8 million for the profit pool. Year 4, we see a big increase in revenues, 11.7 million. We see 4.7 million going back as a return on investors. And now we see year 4, $2.3 million in the profit pool. Now year 5, we see $14 million as an annual profit per center. Again, remember, that's 50% of our KPI. All right. You see these numbers where they can go. Year 5 is 5.8%, goes back to investors. And then year 5, we got our profit pools up at 2.9 million. By the way, just so you know, the annual cost of running one of these is about 2.6 million. And part of that cost, which I'll break down a little bit, some of that goes to the corporate MSO. I'll explain what the management services organization is going to be doing as well. But if you take the numbers for each clinic now and you look at per 4 clinics, so this is the 4 clinics that we've got. So year 1 is 12.5 million, 12.5 million back to investors, no pool here. 25 million is the profits for the 4 in the first year. 17 million is return on investment. 2.5 million goes back to the investment pool. The profit pool. Year 3 is 36 million. As 14 million of that goes back to investment return. Year 3 is 7.2 million. Profit pools, we've seen some major gains happening here in year 3. Year 4 is 47 million. Annual profits for the 4 clinics. We see 18.8 million as investor returns. And then year 4, that's when we start to see 9.4 million in the profit pooling. And then year 5, look at these numbers. It's pretty amazing. It's 58 million annual profits in year 5. 23 million is a return to investments. And then we have a profit pool of 11.6 million on that stuff. Remember, profits and revenue projections above do not include the additional reinvested clinics. So remember, we talked about the 1 clinic turns into 2, the 4 clinics will turn into 8. So let's talk a little bit more about the profit sharing pools, which I think is amazing. 20%, listen to this, 20% of all profits are divided into 2 profit sharing pools. That's after the investors receive their ROI back. Okay. So the first pool, just so you know, the estimated share values. Now, this is estimated share values in pool 1 are going to be around 2,500 each in year 3 per share. Estimated share value in pool 2 is going to be 50,000 per share in year 3. Again, bonus centers could even double those numbers. So what do those pools look like? The first pool, pool 1, is 10% of all profits from every center. So for an investor, if you invest into this program, then for every 100,000 of funds invested gives you 1 share into this pool with a maximum of 10 shares. You max out at 10 with that deal. By the way, for those of you who are not investors, but you bring investors to the table, 1 share is earned for every 100,000 in personal referral investments, by the way, with a maximum of 10 earned shares. And by the way, shares can also be earned through a network of investors with the 50% rule applied to it. Pool number 2, 10% of all profits go to from each center go into this. That's 10% of all profits from each center. For investors, for every 1 million of funds that you invest, it gives you 1 share in this pool. Okay, there's no limit. Okay, there's no limit on number of shares that you can receive. Now, for those of you who introduce people or bring people to this project that invest $1 million, okay, 1 share is earned for every million in personal referral investments as well, with no limitation on the number of shares earned, and shares can be earned through a network of investors with a 50% rule applied to that as well. So these profit share pools are really cool. They're really exciting of what's possible. So where does the 6.25 million go? Okay. So 15% of that goes towards the managing services organization. So that is an organization that we have that deals with all the legal funds, the finances, the compliance, the HR, the PR, the ordering of supplies. I mean, it's a lot of work. Okay. So 15% of the clinic goes towards, each clinic goes towards that. 30% goes to facility acquisition and construction build out. Another 15% goes to staffing and 6 months operating cost. We have 4% that goes to inventory and supplies. We have 20% that goes to medical equipment and technologies. We keep 8% set aside for marketing, branding, and our launch of each of our centers. And then we keep another 8% for working capital and contingencies in case we, need something. There's a contingency, working capital, and et cetera. We have that baked in as well. Now, equity. This is power. This to me is the biggest piece of the puzzle. We want to have every one of our centers. We've already identified the 200 locations across the globe that are the most, that make the most sense for us to do. They're here in the US, they're in Japan, they're in Europe, they're in the Middle East, they're in South America, Central America, all over North America, all over the globe. Okay. What's powerful about that is we want to have an army of people in that region invested into those facilities as well. And why is that important? Because I want to have at least 100, if not 1,000 people in that region that are excited, that are hungry, that are not only using the Biolimitless Centers of Excellence, but are learning and earning off of that you can profit off of. Now, listen to this. This crowdfunding investment model is truly a game changer. For those investing up to 50,000, okay, those investing up to 50,000, this is done exclusively on the blockchain in USDT, okay? Now, and it's based off of your membership level. For those investing over 50,000, you'll purchase a membership tier, and you'll purchase the top tier membership, which is 12,500 on the blockchain with no limits on how much you can invest after that. And you can invest in either USDT or USD Bankwire. Okay. So what's the process look like? Step 1, you got to go in the crowdfund model, purchase a Biolimitless membership. Okay. All memberships give you a 50% discount at the Biolimitless centers up to 4x your membership. Okay. And allows you to contribute up to 4 times your membership to the crowdfund. The top tier membership, the 12,500, you can invest any amount you want. So for example, if you buy a $100 membership, that's gonna save you up to 50% of the $400 total. you can invest up to $400 into the crowdfund. If you buy the $500 membership, you can invest $2,000. $1,000, you can invest $4,000. $7,500 membership, you can invest up to $30,000. And if you buy, let's say, a $2,500 membership and you invest the $10,000, but you want to come back for more, then you just upgrade to that next membership. Most people are purchasing the 12,500 membership because there's no limit on investment, and it gets them the biggest discount to come into the centers as well. So that's step number one. Step number two is you pass the KYC. So US and Canada also requires accredited investors for verification. You sign a PPM, which is a private placement memorandum, and you make your investment. By the way, profit sharing will pay out quarterly in USDT through smart contracts to the wallet attached to your membership. 50,000 and above investors can choose to be paid in either USDT or out in a bank wire. So the system and process is really straightforward and simple. And the reason why this crowdfund model is such a powerful model, because it engages we the people. It's a system that's by the people, of the people, and for the people. I didn't want a system created that was just ran by billionaires and trillionaires. I didn't want a system that was just run by private equity funds. I wanted a system that billionaires and trillionaires could invest in. And we have a lot of them. We have a lot of people that have come and said, I want to put in 10 million, 20 million, 100 million. We have a lot of people that have said those things, but we also don't want to dilute the fact that we want a system by the people, of the people, and for the people. So you and me and everybody has an opportunity not just to participate as a client and a member of the Biolimitless Centers of Excellence, which every one of you will have a chance to do. You get a chance to monetize and profit off of truly bringing back healthcare to the people, by the people, and of the people. So look, I couldn't be more excited about what we're doing. I know you're excited. I know we have people globally excited about this. So what I want you to do is I want you to really dig into this, and I want you to make a decision, and I want you to get involved in this. Go to our website. You can follow the process through there. That website will take you, go through the process of how to do it, or get with the person that sent you this video, and they'll show you how to get a link and go through this process. People are excited globally. We finally get a chance to not just make America healthy again, but make the world healthy again. We get a chance to put health and care back into healthcare. We get a chance to share with the world that we don't have to be dealing with chronic illness. And I believe that every man, woman, and child on this planet has the free will to decide what they want to do with who they want to do and how they take care of their body. The Biolimitless Centers of Excellence is giving you a chance to improve your healthcare and your wealth care. So folks, until we meet again, I'm Dr. Eric Nepute. God bless you, God bless America, and God bless the world. Stay smart out there, and I'll see you next time. Be well.